Hi friends, welcome to Plexus Ortho. My name is Dr. Kanan Kumar and today we're going to discuss a commonly asked topic in your NEET PG exams. It's about common peroneal nerve palsy. And to quickly go into the topic, let's see how the common peroneal nerve comes from the sciatic nerve and what are the muscles it supplies and what is its sensory supply. Right? Sciatic nerve is the one which starts from the lumbar plexus. It starts from the root supply is L4, L5, S1, S2 and S3. If this is a piriformis muscle, the sciatic nerve arises anterior to it. When you see it from the back, so it arises anterior from it and it lies posterior to the external rotators of the hip. That is the superior and inferior gemini and the obturator internus. So the sciatic nerve lies anterior to the piriformis and posterior to the external rotators of the hip, and then it goes down in the posterior compartment of the hip, and then at the level of the knee joint it divides into the tibial portion and the common peroneal nerve portion. So when you take a cross section of the nerve, when you see a circular cross section of the nerve at the level of the thigh, the tibial portion lies in the center, whereas the common peroneal nerve portion lies in the periphery. So this is the tibial portion which lies in the center, tibial nerve portion, and this is the common peroneal nerve portion which lies in the periphery. Therefore, any injury to the sciatic nerve many times, or any compression to the sciatic nerve many times causes only a common peroneal nerve injury and tibial nerve is spared. So this is the reason behind why a sciatic nerve palsy will cause an isolated foot drop injury, because the common peroneal nerve is surrounding or in the periphery of the sciatic nerve as such. Then the common peroneal nerve division, which all of us know, winds around the neck of the fibula. It's a very important anatomical structure. You can run your finger on the neck of the fibula and then you can feel the common peroneal nerve. It divides into two branches which supply the anterior compartment and the lateral compartment of the leg. The anterior compartment is supplied by what is called as the deep peroneal nerve, and the lateral compartment is supplied by the superficial peroneal nerve. What are the muscles in the lateral compartment of the leg? It is a peroneus brevis and longus. So in the lateral compartment, it is peroneus brevis and peroneus longus. And what are the muscles in the anterior compartment which are supplied by the deep peroneal nerve? It is tibialis anterior, extensor hallucis longus, which extends the great toe, extensor digitorum longus, extensor digitorum brevis, and peroneus tertius. Remember peroneus tertius, it may be a good Google in your exam. Peroneus longus and brevis are supplied by the superficial radial nerve, whereas the peroneus tertius is supplied by the deep peroneal nerve. What is the sensory supply of these nerves? So if this is the foot and this is a great toe, right, the deep peroneal nerve comes down and supplies only the portion, the first web space. In the first web space is supplied by the deep peroneal nerve. Most of the dorsum of the foot is supplied by the superficial peroneal nerve. Most of the dorsum of the foot is supplied by the superficial peroneal nerve. The lateral border of the foot is supplied by the sural nerve, and the plantar aspect of the foot is supplied by the tibial nerve. And all the posterior compartment muscles are supplied by the tibial nerve. Right, and usually when this deep peroneal nerve goes into the anterior compartment, it initially is lateral to the anterior tibial artery. When it comes at the level of the ankle joint, it becomes medial to the level of the tibial artery, and this is the relationship between these structures at the level of the leg and the ankle, which is important for clinical purposes. So just for recap, common peroneal nerve winds around the neck of the fibula, divides into the deep peroneal nerve and the superficial peroneal nerve. Deep peroneal nerve supplies the anterior compartment, superficial peroneal nerve supplies the lateral compartment. Deep peroneal nerve gives sensation to the first web space. Most of the rest of the dorsum of the foot is supplied by the superficial peroneal nerve. Now, what are the causes of foot drop? We've just discussed it. The nerve winds around the neck of fibula, and therefore trauma is an important aspect. Any trauma to the lateral aspect of the knee dislocation can cause a foot drop. What are the other common cause in India? It is Hansen's or leprosy. Leprosy can also cause a common peroneal nerve palsy. Why is the common peroneal nerve more commonly affected than other nerves? Because it is superficial and it is just below the level of the skin. And for some reason, leprosy affects these nerves which are more superficial in location. For example, the ulnar nerve, greater auricular nerve, the common peroneal nerve. So these are the nerves affected in leprosy. You can also have upper motor neuron lesions like stroke. You can have stroke. You can have transverse myelitis or some spinal cord problem. Transverse myelitis or spinal cord problem. You can have sciatica. Sciatica. You can have multiple sclerosis. Multiple sclerosis. Anything that affects the peripheral nerves can also affect, including diabetic neuropathy can affect the common peroneal nerve. Among all the peripheral nerves that we know of, you know the radial nerve, median nerve, ulnar nerve, and now the common peroneal nerve. Common peroneal nerve has the poorest prognosis for some unknown reason, and many times we have to end up doing salvage procedures like tendon transfer. So what basically happens in a foot drop? What is the patient not able to do? The muscles affected are tibialis anterior, as we know, the anterior compartment muscles, tibialis anterior, extensor hallucis longus, extensor digitorum longus. These are the three main muscles affected. So therefore the patient cannot dorsiflex the ankle, cannot extend the great toe, and cannot extend the other toes as well. So what happens? The patient has a dragging kind of gait. Patient is not able to lift off the foot and clear the ground for every step. So therefore the patient has a high stepping gait. It is called a high stepping gait, which is seen in foot drop. High stepping gait is seen in foot drop and the patient is not able to clear the ground. In these cases you have to in the early stages you have to use what is called as a foot drop splint. This foot drop splint will prevent the foot from dropping down and help in keeping the foot in neutral, and you can clear the ground and patient can walk easily. So this is called as a foot drop splint. This has been asked in various ways in your exam, and you should be able to answer this question, right? So how do you treat common peroneal nerve palsy? If the nerve is injured or cut, you can do nerve surgeries like nerve grafting or nerve repair and using microsurgical techniques. But if the recovery does not happen, or if there is the time frame from the injury to the presentation is very long, then you will have to do salvage procedures or tendon transfers. So you should do what is called as a tendon transfer to reproduce dorsiflexion of the foot. Tendon transfers to reproduce dorsiflexion of the ankle, right? That is the main lacking feature of the foot drop patients. So what you have to do is you have to take tibialis posterior. You have to take tibialis posterior muscle. Tibialis posterior muscle is spared in common peroneal nerve injuries because tibialis posterior is a posterior compartment muscle which is supplied by the tibial nerve, and therefore it is spared. And the tibialis posterior inserts into the navicular bone. Tibialis posterior is an important everter and plantar flexor. Everter and plantar flexor of the foot. So you divide the tibialis posterior at the level of the navicle. So this is the navicular area. You divide the tibialis posterior from there, and then you insert it anteriorly at this location to help in dorsiflexion of the foot and ankle. So this is the tendon transfer or salvage procedure for foot drop patients who do not recover from a common peroneal nerve palsy. I hope that gives you a brief idea about common peroneal nerve palsy and its implications. Let us look at two representative questions that have been asked in your previous NEET PG exam. Foot drop, so let's look at this question. It says foot drop injury occurs due to which of the following nerves? Very clearly we know the answer. This is a very straightforward question. Superficial radial nerve, peroneal nerve, no. Deep peroneal nerve, yes. So common peroneal nerve injury which affects the deep peroneal component of the common peroneal nerve injury is the one which is affected. Posterior tibial nerve, no. Anterior tibial nerve, no. So these are not the answers. The answer is deep peroneal nerve. So we all know the common peroneal nerve winds around the neck of the fibula and then divides into deep peroneal nerve and superficial peroneal nerve. Deep peroneal nerve supplies the anterior compartment. Superficial peroneal nerve supplies the lateral compartment, and anterior compartment muscles are the ones which are responsible for the foot drop. So the answer to this question, straightforward question, is deep peroneal nerve. Let's look at the second question. The question is injury to the common peroneal nerve at the lateral aspect of the head of the fibula results in all the following except. Okay. So they are talking about an injury to the common peroneal nerve and not a superficial or radial or deep. So they're talking about a combined superficial and deep peroneal nerve because this is before the bifurcation of the common peroneal nerve. Weakness of ankle dorsiflexion, yes, tibialis anterior is affected in this condition and therefore there is a weakness of ankle dorsiflexion. Foot drop, you will see a foot drop which is same as ankle dorsiflexion weakness. Then loss of ankle reflex, no, the ankle reflex is by the tibial nerve. It is the tibial nerve and not the common peroneal nerve which causes the loss of ankle reflex. Sensory loss in the first web space, yes, there will be complete loss in the loss of sensation in the dorsum of the foot. The first web space is supplied by the deep peroneal nerve and the rest of the dorsum is superficial peroneal nerve. And because the combined injury, so both whole of the dorsum of the foot will be insensate. So the correct answer is in this except question is loss of ankle reflex, which is mediated by the tibial nerve and not the common peroneal nerve. So with that, we come to an end of this discussion about common peroneal nerve for NEET PG. Hopefully this helps you. Please do let me know if you have any queries. We can discuss and further clear your doubts. Thank you very much. My name is Dr. Kanan Kumar and this is Plexus Ortho.